Welcome back to my channel. Today I'm going to present respiratory disorders of children. Now we'll see introduction. The respiratory disorders are very common in children. They account for much school absenteeism and family disruptions. Preschooler children can have up to respiratory infections per year. Now we'll see the what are the factors affecting respiratory disorders. There are mainly two factors are there, environmental and social factors. So first one, parental smoking. So in that child's family, their parents are under smoking habits. Then age, number on age of siblings. The children is having many siblings. Then immunization status. They didn't take proper immunization status, no immunizations, or that means vaccine. They didn't take proper immunization vaccines. That is also one of the factors affecting the respiratory disorders. Then overcrowding. Then breastfeeding. The lack of breastfeeding is also they're able to get the respiratory disorders. These are the common factors affecting respiratory disorders in childhood period. Now we'll see anatomy and physiology of respiratory system. So already we know, right? In that anatomy, what we have to study? We're going to study the structure of the organ. And physiology, we have to study regarding the functions of the organs. Mainly the respiratory system is divided into three levels: upper respiratory system, middle respiratory system, lower respiratory system. The upper respiratory system is consist of ports, nose, pharynx, sinus. Then middle respiratory system, larynx and upper trachea. And coming to lower respiratory system, lower trachea, bronchi and bronchioles and alveoli. So these are the common respiratory system parts. Next one, what are the common respiratory tract disorders of childhood period? Upper respiratory tract disorders and lower respiratory tract disorders. Under that upper respiratory tract disorders, tonsillitis, corneal atresia, epistaxis, aspirations. These are the common respiratory tract disorders under that upper respiratory tract. Then coming to lower respiratory tract disorders, bronchiolitis, bronchitis, bronchopneumonia, asthma, cystic fibrosis. These are the common respiratory disorders are there in childhood period. Now I'm going to present tonsillitis. What are the specific objectives? Define tonsillitis, causes of tonsillitis, clinical manifestations of tonsillitis, pathophysiology of tonsillitis, what are the management of tonsillitis, what are the complications, then what are the nursing diagnoses and interventions of tonsillitis. Tonsils are collection of lymphoid tissues and parts of the immune system. The tonsils are situated at the back of the throat. Main functions of tonsils is defense mechanism. Already we know what is meant by defense. Defense is nothing but fighting, right? So the tonsils are the body's first line of defense against inhaled pathogens. Any foreign bodies it will be enter into the children body means the tonsils are supposed to start the defense. Now we will see the definition of tonsillitis. Tonsillitis is defined as infection and inflammation of the tonsils. See, these are the tonsils. Next, we'll see the etiology of the tonsillitis. Viral infections, bacterial infections. Viral infections by adenovirus, rhinovirus, influenza, coronavirus. Then bacterial infections. Those are Streptococcus pneumoniae, Mycoplasma pneumoniae, Bordetella pertussis and some others. Next one, pathophysiology. So when you have to write pathophysiology, no need to write the point wise. Must and should you have to draw the flow chart. Due to the etiological factors, the foreign body will be enter into the children's body, either bacteria or either viruses. Once the virus or bacteria, it will be enter into the children's body means after they suppose start their action. Their action is nothing but what is the foreign body action? It infection and inflammations. So here now we are going to discussing the tonsillitis. No, once the bacteria and virus will be enter into the children's body, no, as a result of inflammation of the tonsils, then it leads to the midline and obstruction of the passage of food and air. That leads to block the posterior nads and it resulting in the mouth breathing. See here, already I said no. Entry of pathogens. Pathogens is nothing but microorganisms. Then that leads to triggering of mast cells. That leads to release of inflammatory mediators. That leads to inflammation of the tonsils. The inflammation of tonsils may develop the related signs and symptoms or clinical manifestations. Based on that clinical manifestations only, the children's or the patient is supposed to admit at the hospitals. Based on that symptoms only, we supposed to the objective data. Next one, signs and symptoms or clinical manifestations of the tonsillitis. Those are first one, sore throat, red and swollen tonsils. Third means we have to observe the swellings towards the tonsils, pain when swallowing. When we are able to do the swallowing, no, that time pain we may observe. Then high temperature, body temperature it will be increased. Then coughing. Then the children they may get the headache, tiredness. Then chills, malaise, swollen lymph nodes, pain in the ear and neck. Less common symptoms here include nausea, stomach ache, vomitings, worry tongue, bad breath, voice changes, difficulty opening the mouth. So these are the less common symptoms than the before symptoms. Next one, investigations or diagnosis of the tonsillitis. First, we have to do the complete blood count and GPE. That means general physical examination. Then throat swabs and throat cultures. By doing these investigations, we have to find out the degree and status of the tonsillitis. Management. So before going to management, what is the in my therapeutic? Therapeutic is nothing but modification. It is either diet, either medicines, or either etc. So therapeutic management is nothing but based on the with some doctor's orders only we have to start the treatment, isn't it? Then therapeutic diet also we have to modify the regular our diet pattern. So that is the therapeutic. So now we'll see the therapeutic management. First one, medical management, analgesics, antipyretics, antibiotics. By giving these medication to the children means we have to improve the child status. Analgesics means that is a painkillers, no. Then antipyretics mean by giving antibiotics to the children, we have to normalize the body temperature of the children. Then antibiotics. The why antibiotic we are going to start means because of these tonsillitis is due to the virus and bacteria. No, In must and
surgical
should we have to
management,
observe the infection and
tonsillectomy.
inflammation. Tonsillectomy is one of the surgical management or surgery. We have to remove the tonsil by doing this operation. This is the preoperative care. Assessment of the children should be done for the other respiratory infections. History about the bleeding tendency should be considered. Then examination of bleeding, clotting time or necessary. So must and should in the preoperative care before sending to the patient. Must and should we have to assist the head to foot. Then surgery site also we have to remove the all jewelries. Then we supposed to wear the body gown to the children's. Next, post-operative care. The post-operative care is nothing but we're going to start the care after surgery. Next one, complications of tonsillitis. First one, peritonsillar abscess, parapharyngeal abscess, intratonsillar abscess, tonsillar cyst. Nursing diagnosis. Ineffective airway clearance related to pus, acute pain related to the presence of inflammation of the tonsils, then imbalanced nutrition less than body requirements related to inadequate intake, hypothermia related to acute infection by microorganisms or foreign bodies, disturbed sleep pattern related to the pain in the tonsils area. These are the common nursing diagnoses for the tonsillitis. Nursing interventions. Abdomen or sideline position to facilitate drainage of secretions. Tepid sponging to reduce temperatures. Based on the children temperature we have to follow. Then a soft to liquid diet is preferred. Warm salt water gargling is very important. Administer analgesics and antipyretics as the based on physician's order. By explaining cause of diseases will relieve patients or child anxiety or parental anxiety. Tonsillitis is very important question in your exam point of view. Mostly 7 marks they supposed to ask nursing management. So nursing management they supposed to ask means no need to write point wise. We have to list out the nursing diagnosis at least 10. So based on that nursing diagnosis we have to write the at least 5